Welcome back to ArkanSense, where we try to take an unbiased look into issues affecting the natural state. And today, we're going to talk about the Arkansas Works program. Again, there's so much information to know. If you really want to understand the program, it had to be broken up into 2 episodes. This is part 2, which will cover what the work requirement is, how it was implemented, whether it's achieving its goals, and what's likely to happen to it in the near future. If you want to skip directly to one section of this video, you can click on the time codes in the description below. You'll also find a link to episode 1 in case you want to go back and watch that. And just to make sure we're all on the same page, let's start this one with a brief recap. Medicaid is a federal grant program to help pay for the medical expenses of medically frail and low-income people. For every medical bill, the federal government pays for half or more, and the state pays the rest. Medicaid initially only covered specific groups of impoverished people, and the income level covered was different for each state. States had the option to expand it beyond those people, but didn't have to. When Obamacare was passed, it included Medicaid expansion, which made Medicaid cover everyone under a set national level, not based on the state. The federal government would pay for 90% of the new costs, and the state would carry the other 10%. These expansions were requirements for participation in the program, so states either had to expand their Medicaid or lose their grants. But the Supreme Court ruled that forcing states to make that choice was unconstitutional, and so the expansion became optional. Arkansas chose to expand using a special waiver to create a program where Medicaid money was used to buy private insurance plans for the people covered, rather than providing state-run insurance. After he was elected, Governor Asa Hutchinson made some big changes to the program and renamed it Arkansas Works. He also wanted to include a work requirement for healthy people getting Arkansas Works. The first time he asked the federal government permission to add that, they said no, but then President Trump was elected, so Governor Hutchinson asked again, and they said yes. And just to clarify, Arkansas Works is now the name for the Arkansas version of Medicaid expansion, with or without the work requirements. Prior to the implementation of the new work requirements in June of 2018, approximately 1 million Arkansans, or about a third of the state's population, were covered by Medicaid in some way. Of that 1,285,000 were covered by the private option under Arkansas Works. That's just under 1 out of every 10 Arkansans. The rest were covered by pre-expansion Medicaid still run through the state. The new work requirements applied to anyone covered by Arkansas Works who was under 50, able-bodied, and didn't fall under any exemptions. Those exemptions included things like people receiving unemployment, pregnant women, certain medical conditions, or anyone providing primary care for a child or someone who is incapacitated. Anyone covered by the requirements would need to show each month that they had spent at least 80 total hours working, searching for a job, volunteering, going to school, in an addiction program, or fulfilling the requirements in some other state-approved way. For the rest of 2018, the requirement would apply to people between the ages of 30 and 49. Then, in 2019, that would expand to also include people as young as 19. Everyone covered by Arkansas Works was sent a letter informing them of the changes and letting them know if they were exempt or if they had to report hours. For those that did, they would need to register on the new state-run website using the login information from that letter. Then, each month, they would log in and report their hours. They would also need to provide verification for those reported hours. Anyone who went for 3 total months in the calendar year without reporting enough hours would lose their Arkansas Works coverage, and they couldn't reapply for it until the following January, even if something changed to make them exempt from the work requirement before then. On August 6th, Governor Hutchinson gave a press conference showing that, for the first time since the state had started its Medicaid expansion program, there had been a full fiscal year with no Medicaid spending growth. The governor credited this to an improving economy, changes made since the Arkansas Works rebranding, and a statewide purge of the Medicaid rolls, removing people no longer eligible. This milestone happened before anyone had been dropped because of the new work requirements. The rollout of the work requirement wasn't done all at once, but over the course of a few months, with the first group required to report their work hours for June. Many people in the program didn't have to report work hours because their employer, college, or rehab program was already reporting directly to the state, or because the state already knew about an exemption. Out of those who were supposed to report, about a quarter of them either did so successfully or claimed they had an exemption that the state wasn't aware of, but about 3/4 of them didn't report at all, and as time went on, those numbers did not get better. In August, just over 800 people reported enough, with almost 13,000 not reporting at all, and in September, about 1,200 people reported successfully, but over 16,000 didn't. September was also the first month someone could lose their Arkansas Works coverage for 3 months of not reporting. Governor Hutchinson announced that about 4,300 people were being dropped, and about that same number were dropped each month for the rest of the year, totaling around 18,000 kicked off through the end of 2018. Governor Hutchinson, in his press conference announcing the first round of removals, attempted to frame them positively.
there's 4,300 beneficiaries that will be locked out of the system now. Those are subject to a $570 per average premium cost. This is not a fee-for-service system in which it doesn't cost us anything if we have 4,300 people on the system as long as they don't ever go in for medical care. This is a system in which we're paying insurance premium for everyone. And so in this instance, 4,350 times the $570 per month insurance cost results in a $30 million cost to the taxpayers to maintain that insurance for 4,300 enrollees that could have moved out of the state, that could have got other employment, they might be working on the side, or they just decide to leave the workforce, or some other circumstances. And I think it would be common sense judgment of the people of Arkansas that we should not continue to pay $30 million per year for that cost.
Criticism came quickly and on many different counts. For example, the monthly savings Governor Hutchinson spoke of only happened because of Arkansas's unique premium assistance system. If the state were to use the same pay-for-service system for everyone that it now only uses for those covered under pre-expansion Medicaid, then people who had moved out of state or had other coverage wouldn't cost taxpayers anything. Governor Hutchinson was also criticized for his speculation on reasons why people wouldn't report. There's no data to suggest that people not reporting are likely not working. On the contrary, among the nearly 25 million Americans who were enrolled in Medicaid in 2016 and also of working age and not on Social Security or disability, about 90% were working full or part-time or had some exemption. But if most people are likely compliant or exempt, why wouldn't they report that? For one thing, they may not have received the initial piece of mail informing them how to do so. People with little income are less likely to have a permanent address. They could be moving between friends or family, or they might have had a permanent address and be waiting until they get one again to file that change with the DHS. And some people who did receive mail from the DHS said they received multiple letters with contradictory information on whether or not they needed to report. Some also said the letters were so long and confusing that they gave up on trying to read them. Second, certain types of work situation don't require that you report because the state already has a record of your employment. Some people said they were confused about whether or not their job reported automatically. Third, it's estimated that about a third of the people subject to the work requirement don't have internet access at home. And while local DHS offices have computers and people willing to help them with the reporting process, those offices are open at the same hours most people are working. Someone impoverished enough to need Arkansas Works may not be able to afford the time off to visit the DHS, and there's no requirements that employers say yes when they ask for it. Fourth, the website for reporting has had some issues. The site has consistently been described by those who have to use it as hard to navigate and plagued with issues, including random blank screens and correct passwords being rejected. The website is also not backwards compatible with older versions of browsers and is down for maintenance 10 hours each day. For all of 2018, this website was the primary way you could report your work hours. The state did take notice of some of this criticism. DHS Director Cindy Gillespie defended continued use of the website, saying that it could help participants develop internet literacy skills. She also said they didn't default to in-person reporting because it would have cost the state more money. But finally, in 2019, the state began allowing people to report their hours by phone. At the end of 2018, with 7 months of the program for reference, there was much discussion as to whether the Arkansas Works work requirement was working. The goal of the work requirement was to get people on Arkansas Works working, which in turn would hopefully get some of them on a workplace health insurance program and reduce premiums for everyone. There's also evidence to show that people who are working are generally more healthy. If you assume a cause and effect relationship, then more people at work would mean more healthy people and another reduction in costs. The work requirement was also meant to foster independence, to help people reach a point where they no longer needed assistance from government healthcare programs. Section 1115 waivers require that a state hire an independent organization to evaluate if that state's program is reaching its goals and providing at least the same level of coverage as the Medicaid program would without the waiver. But Arkansas has not done this as of February 2019, and the Trump administration has rejected the Arkansas plan to hire one multiple times. From early 2017 to early 2019, the unemployment rate in the state remained relatively unchanged, but that rate only measures people actively looking for jobs and not currently doing any work at all. Over that same time period, the labor force participation rate, which includes people who've given up on job searching, dropped but then recovered, ending within a percentage point of where it had had been. And all of these things put together make any evaluation of the work requirements speculation or assumption to varying degrees. Governor Hutchinson seems to believe the work requirements are working and continues to defend the reasons behind them, like in this interview with Talk Business and Politics.
We've had, I believe, 3,800 people, because of that notice and that work requirement, move from non-work into employment and up the economic ladder. That's a success story, and we're not seeing a jump in uncompensated care. And so that tells me that these numbers that are going off are numbers that have moved out. They were raising the income level in Arkansas, so all of a sudden they're making more money. They no longer qualify for Arkansas Works. And without this kind of process of putting the work requirement, sending out the notice, we'd continue to be paying those insurance premiums every month for people who are no longer eligible for it. That's not the kind of system we want. So it is achieving that objective of cleaning out the system, encouraging people to work. So we're working the system the best we can, but I believe it is very, very important in terms of the taxpayers' dollars, in terms of our work ethic, in terms of responsibility that we continue to implement it.
Additionally, out of about 18,000 people who lost coverage in 2018, the number who reapplied in January of 2019 was only 1,400. Governor Hutchinson claimed that this was because many of the people who were eliminated from the program had either moved out of the state or found their own insurance, because otherwise they would have reapplied. On the other hand, critics pointed out that the governor's reported number for how many Arkansas Works recipients had found jobs doesn't actually distinguish between unemployed people who found a job and people moving from one job to another. It's all counted as new employment, so it's not necessarily a positive sign. Also, some critics believe that most of the people dropped either didn't understand the process, weren't made aware of the requirements, or tried to report but had problems with the technology like we talked about earlier. And the low number of reapplications, they claimed, was because people weren't made aware that they could reapply. When the Arkansas Times asked a group of Arkansas Works recipients for their opinion on the work requirements, the results were actually mixed. Some supported them and others opposed them, but all of them said that the reporting system was broken. And when the Kaiser Family Foundation ran a study on 31 Arkansas Works recipients, as well as some caseworkers, almost everyone interviewed said they'd had issues with the reporting process despite meeting the work requirements. Participants also consistently reported that the new work requirements did not give them more incentive to find a job, but instead just added more anxiety to already stressful situations like homelessness, searching for work, or living paycheck to paycheck. Some also reported that they were suffering from chronic health issues only kept in check because of their Arkansas Works insurance, so losing that coverage could mean worse health and possibly becoming unable to work. So far, the only federal assessment of the program came from the Medicaid and CHIP Payment and Access Commission, or MACPAC, an independent federal agency which evaluates Medicaid and CHIP-related programs and provides unbiased recommendations to legislators. In November of 2018, MACPAC wrote a letter to the Secretary of Health and Human Services regarding Arkansas's work requirements. MACPAC said they were very concerned with the number of people dropped from the program and believed that many of them had been dropped because of the reliance on the online reporting system and a lack of beneficiary awareness. MACPAC also pointed out the lack of new funding for workforce training and possible barriers to people accessing the services that do exist. But perhaps their biggest concern was the lack of data, thanks to the state's failure to hire an independent oversight group. As a result, MACPAC called for a stop to anyone being dropped from the Arkansas Works program until the state could rework it to fix some of the major issues and get a system in place for evaluation. As of February 2019, the Department of Health and Human Services has not acted on this recommendation. Finally, let's talk about the future of the program. Our state legislature is overwhelmingly Republican, outnumbering Democrats 3-1 in both houses. For the first few years under Governor Hutchinson, some of those Republicans tried to defund Arkansas Works, decrying it as an extension of Obamacare. But ever since the work requirements were added, that pushback has weakened and the program seems safe on a state level. But federally, things are more complicated. For one, the Trump administration has proposed turning Medicaid expansion into a block grant program. That would set an absolute cap on the amount of federal funds available for Arkansas Works. Second, there are also some states who didn't participate in Medicaid expansion and are now looking to put work requirements on their basic Medicaid programs. Mississippi has filed for the first of these waivers, which includes work requirements on parents and caretakers. Some other states have said that if Mississippi is successful, they might do the same, and if this were to pass, Arkansas could could see it as an opening to eliminate some exemptions from its own work requirements. Finally, the Arkansas Works program will be reviewed in court soon, and here's why. About half a year before Arkansas was approved for its work requirements, Kentucky was approved for a similar waiver. Their work requirement also set a minimum of 80 hours for a similar group of people and fulfillable through similar means. But before they could be implemented, the requirements were challenged, and the case was sent to federal district court rather than a local court after it was deemed to be of national significance, presumably because it could set a precedent for later challenges, like one from Arkansas. The guidelines for Section 1115 waivers say they should offer alternative ways likely to assist in promoting the objectives of the federal program they're granted for. So if a proposed waiver would create a state program not likely to meet those objectives, it shouldn't be granted. The judge ruled that coverage of everyone under the income cutoff was an essential objective of Medicaid expansion, so any waiver which could cause loss of that coverage, like through a work requirement, should not have been granted in the first place. The Kentucky lawsuit was struck down the same month Arkansas began implementing its work requirements, and just a few days later, Arkansas residents filed a suit challenging them. That case was sent to the same judge who had presided over the Kentucky case. In late 2018, the Trump administration approved another waiver for Kentucky with only slight changes from the one that had been struck down. The administration then filed a motion to dismiss the lawsuit from Arkansas. The Trump administration might see this as a test case, which could undermine its other 1115 waivers and its attempt to weaken Medicaid expansion. Hearings for the Arkansas case have been set for March of 2019, and the plaintiffs have requested the judge make a ruling before April. That's the first month a new batch of people could be kicked off of Arkansas Works for 3 months of not reporting in 2019. The renewed Kentucky application will be up for review by the same judge on the same day. If the judge rules against the challengers, then things in Arkansas stay more or less the same as they are now. But if the judge overturns the waivers, then Arkansas might have to stop dropping people from the Arkansas Works program, at least temporarily. No matter which side wins, if the case is appealed, it would head to the U.S. Court of Appeals, and if it goes beyond that, the Supreme Court. This could be a long and bitter fight, especially if the work requirements are overturned in district court, since the Trump administration seems to be so personally invested in the issue. And that's it. We're done. At least until we need a part 3. For as long as Arkansans have participated in federal medical programs, we've lived a sort of dichotomy. On the one hand, we are one of the states that takes the most advantage of them, but on the other, Arkansans generally oppose Obamacare and S-CHIP, unless you call them Arkansas Works and our kids, and then they like them. Maybe because when the programs are seen as ours, we get to feel a little more independent. That internal Arkansan struggle between accepting help but wanting to feel self-sufficient has led us to take a program meant in part to give people health care so they could work, and switching it around so they have to work to get health care. Arkansas continues to function as a laboratory of democracy, but should the experiment continue or be shut down? What do you think? Thanks so much for watching, and a special thanks to Benjamin Hardy for his help with this video. If you enjoyed watching this and want to see more videos like it, please support ArkanSense on Patreon. Patreon is the easiest way to support content makers in a way that works for your budget. You decide how much you want to give each month, and you can change that amount at any time. Bigger donations get bigger perks, and speaking of perks, a special shout out to Zach Green, whose monthly donation let him pick the topic for this video. Thanks also to our other donors, Don Hughes, Zach Clark, Jason Sanders, and Kelsey Robbins. Thanks again, and catch you next time for more ArkanSense.